Let's bring in Dr. Amesh Adalja. He's Johns Hopkins Center for Health Security Senior Scholar. And Doctor, we have gotten this messaging from the White House that has consistently been, if you're unvaccinated, you're certainly not safe come, the height of winter, but also that this is not a repeat of 2020 because of the tools and, more importantly, the vaccines that are in place. Talk us through what you've seen in some of your hospitals and how this differs from what we have seen before.
This differs greatly than the situation just a year ago because we've got so much more knowledge. We've got a large swath of the population vaccinated, especially high-risk individuals who are elderly or live in nursing homes. We have antivirals on the cusp of being approved for outpatient use. We've got monoclonal antibodies. We've got rapid tests. So it isn't the same as what it was last year. And when I worked at the hospital this entire weekend, and what I see are unvaccinated individuals with COVID-19 taking up hospital beds. That's where we are right now, that this is a two-track pandemic where if you are fully vaccinated and you get a breakthrough infection, and remember, breakthroughs with Omicron are basically inevitable. It's going to be mild, and that's a win for the vaccine. But for those who are not vaccinated and have high-risk conditions, they are going to get sick. Many of them are going to require hospital beds. Many of them are going to die. And that's what we're dealing with right now, is the vaccine is working exactly as it's meant to do. However, there's too many people that are not vaccinated.
Dr. Adalja, Anjali here. I wonder about when we're talking about what to do in response to that. I know many medical experts who are canceling Christmas plans, for example, as a result, or other holiday plans as a result, especially for travel. And I've been seeing that all over Twitter. I wonder if you could sort of iron that out for us, because while we do have the tools, there are still lots of precautions being taken. Is that sort of how we should think about this?
I think that you have to really look at your own risk tolerance. And if you're somebody that's fully vaccinated, you don't have any high risk conditions, I think it's okay just to have your Christmas party the way you were going to. You can think about rapid tests if you've got unvaccinated people there. But remember that this isn't going away. This is an endemic respiratory virus. And we have to be satisfied with the fact that if we're prevented from severe illness, that's the best we're going to get. There's always going to be COVID-19 cases. And I think you have to really just incorporate that into your worldview, because we're always going to have some level of COVID risk that can't be down to zero. And when you're dealing with a respiratory virus like this, the best you can do is tame it to make it more like other respiratory viruses we deal with year in and year out. And for the fully vaccinated, that's what this is. And it's going to increasingly become so as the Pfizer antiviral approaches approval. But we can't kind of go back to 2019. The post-pandemic world is a world in which there is always going to be some level of COVID risk. And we've got to teach people how to risk calculate and be okay with that fact.
I will tell you, just anecdotally, walking around New York City this weekend, those lines for testing are back. And there seems to be some confusion about which tests people should actually adhere to, whether the PCR tests are more accurate. A lot of people looking for those at-home test kits so they can take that with them to family gatherings. Can you sort that out for us? And is there a bit of an inconsistency in the testing infrastructure, the system that exists today?
Well, the testing infrastructure is a disaster. It's been a disaster from day one. It was a disaster during the Trump administration. It is still a disaster in the Biden administration. But when it comes to which test to order or to get, you have to step back and ask, what question are you asking of the test? Most people are just trying to say, I was exposed. I want to know if I'm a danger to others. And for that situation, the rapid antigen tests work perfect. They tell you whether or not you're contagious, and people should be using those when they're exposed, when they have symptoms. That should be the first line. If you're sick, if you're in a hospital setting, that's where a PCR test might be useful, because there you want to really know what's making me sick. But if you're just trying to say, am I okay to go around other people, the rapid antigen test is what you should be getting. And I think it's unfortunate that they're in such scarce supplies. This was predicted, and this is just another failure with the way the pandemic response has been managed. And hopefully that supply will get better as we get further into this wave. But it's really frustrating to see these lines occurring again this far into the pandemic.
And I also want to talk about the vaccinations. I know that generally speaking, there have been a lot of concerns about mixing and matching, and the idea that we saw last week of the CDC's move on recommending really against Johnson & Johnson. How is that going to change, people's confidence and the level of protection that we can expect through this winter surge?
Well, we also, for this, you also have to take a step back and understand what are we trying to prevent. Vaccines are not magic force fields. They're not bug zappers. They're not going to stop every infection. Our goal is to make these infections mild. And for the Moderna and Pfizer vaccines, the 2-dose regimens in healthy people are protecting against what matters. For those at high risk, people above the age of 65 with other conditions, they should get a booster. J&J, as well as AstraZeneca, which is not used in the US, don't seem to have that same level of protection against the Omicron variant. It's unclear what protection they have against serious disease. And I do think mixing and matching for people who got the J&J vaccine, they should get an mRNA vaccine as their second dose. That's going to at least protect them more. And they're going to be protected from serious illness, hospitalization, and death. But with any of these vaccine regimens, with Omicron and its mutations, breakthrough infections are to be expected. That's what this virus is going to do. It has evolved to get around the immunity from prior infection and to get around the immunity from our vaccines. But because in a vaccinated person, this is a mild illness, I think we have to take that as a win. It's just that we've got too much kindling in the terms of unvaccinated high-risk people in certain parts of the country, that's where the concern really is. It's not about the vaccinated, it's the unvaccinated that we really have to worry about because of their impact on hospital systems.
And finally, Doctor, we're talking so much about the Omicron variant, but Delta variant is still quite prevalent. And I'm wondering what you're seeing in your hospital specifically, if in fact, as Dr. Fauci says, the Omicron variant is really going to become more prevalent in January and take over. Is that ultimately a good or bad thing, or does it not matter given that this is really about the unvaccinated at this point?
It depends on how you look at it, because the unvaccinated were destined for a date either with Delta or with Omicron. The thing is, Omicron is going to move faster, so that might mean that we see an uptick in hospitalizations quicker than we would if Delta made its way through that unvaccinated population. And for some hospitals in certain parts of the country, that's going to be difficult because they're already dealing with Delta surges, and now they're going to have a faster pace of infections when Omicron comes. And we have to see how these two strains actually battle it out. But that's the major concern. But it really primarily is the unvaccinated, and because the unvaccinated require hospitalization at a high rate, that's the issue that we see, is that these people choose not to be vaccinated, but then they choose to come to their community hospital and destroy it.
Dr. Amesh Adalja, it's always good to get your insight. Johns Hopkins Center for Health Security Senior Scholar, and our thanks to Anjali as well.